Now at 4:30, spring may be here, but for many allergy sufferers in North Texas, it feels more like the pollen perfect storm.
It's been awful for a while. The Asthma and Allergy Foundation of America ranks Dallas now as the 7th worst city for allergies. That's compared to the average. We're getting worse since Dallas was at 23 on this list last year. But as you see here, it's not the only city in Texas to rank worse than average. People in McAllen, San Antonio, Houston, all of us collectively reaching for the tissues.
Partly because that news just makes us want to cry. Well, doctors say several factors are to blame. Joining us now is Dr. Mudita Shah. She is an allergist at Texas Health Harris Methodist Hospital, Fort Worth. So why the big jump? Why is it that it seems like we're suffering so much more now compared to maybe this time last year?
Well, you know, allergies wax and wane, and it has to do a lot with the temperatures. When it gets warmer, when there's more rain, pollen just love to burst. And in Texas, we have cedar season, we have tree season, we have grass season. This is prairie land. Grass grows for 6 months of the year. So there's not a lot of lapse in pollen sources.
So what can we do to ease the suffering besides some of the over-the-counter medications that are out there? Because sometimes there are so many things out there, you just don't know what to take. What is going to work for me?
And one of the things I see that a lot of people do is they take multiple forms of the same medication. So they'll take a short-acting antihistamine, they'll take a long-acting antihistamine, they'll use an addictive form of the nasal spray over the counter that seems to make things worse instead of better. So it's important to know that what you're taking and what category of medicine it is, so that you can speak with your pharmacist, your primary care physician, and allergist if it's getting very severe. But what you take, you make sure you take a reasonable amount of and not overdose on.
Is it important, do you think, for people to get scratch tests and things like that to find out exactly what it is you're allergic to maybe pinpoint a better source of treatment for you specifically?
Well, the nice thing about knowing what you're allergic to is then you can at least start your medicine regimen before the season begins. Because studies have shown that if you start your medicine before your season, you're more likely to have control. So it's less of a guess on what you need and when you need it.
I take some allergy medicines, and we've talked about this. I wasn't allergic as a kid, but now it seems like I'm allergic to everything that grows. And I take things year-round. Is there a downside, a detriment to taking medication all the time?
Not usually. As long as you're not taking large quantities, most of the over-counter medications are safe. If you have any kidney disease or liver disease, sometimes your body doesn't clear the medicine like it should. There are some side effects like somnolence or drowsy sleepiness. Those things can happen, but in general, the over-the-counter medications, if taken appropriately, are okay.
Okay, so if you could tell our viewers just one thing today about that they need to do if they're suffering this time of year.
Well, I would tell people that it's important to make sure that you take control of your allergies. You know when your season is, you start your medications like you should, and you're careful to not overdose or take too much of something.
Right, because too much of something isn't always a good thing.
No.
All right, thank you very much, Dr.
Nice to
Shah.
meet you.
Appreciate it.